Necrotizing Autoimmune Myopathy, also known as NAM, is a rare disease where the body's own immune system mistakenly attacks the muscles. Think of it like a security guard, the immune system, that confuses the building's walls, muscle fibers, for intruders and starts damaging them, causing the muscles to become weak and break down. The main causes of NAM are special immune proteins called autoantibodies, most often anti-HMGCR or anti-SRP, that target muscle cells. Certain medicines, especially cholesterol-lowering drugs called statins, which can trigger these antibodies in some people. Sometimes infections, cancers, or other autoimmune diseases can also set off the reaction. For example, a person who starts a new statin pill might notice muscle weakness a few weeks later, because the drug sparked an immune response. People with NAM usually feel sudden worsening weakness in the hips, thighs, shoulders, and upper arms. They may struggle to climb stairs, rise from a chair, or lift a grocery bag. General tiredness and sometimes mild muscle pain. Very high levels of creatine kinase, CK, in blood tests, a marker that muscle cells are breaking down. Imagine trying to stand up from a low chair and feeling as if your leg muscles are too weak to push you up. That's a typical everyday example of the weakness. Doctors diagnose NAM by blood tests showing high CK and checking for the specific autoantibodies. Electromyography, EMG and MRI that look at muscle activity and inflammation. A muscle biopsy that reveals dead necrotic muscle fibers with little inflammation. Treatment usually starts with steroids like prednisone to calm the immune system, followed by other medicines such as azathioprine, methotrexate, IVIG, or rituximab if steroids alone aren't enough. For instance, a doctor may prescribe a short course of prednisone and later add a weekly pill of azathioprine to keep the disease under control. Because NAM is driven by the immune system, prevention focuses on avoiding known triggers. Use statin drugs only when clearly needed, and watch for muscle symptoms after starting them. Regularly review any new medications with a doctor. Early screening for cancers or other autoimmune conditions if you have unexplained muscle weakness. A practical tip: if you start a new cholesterol pill and notice unusual muscle fatigue within a month, call your doctor promptly for a CK test. These research steps are helping doctors choose more precise medicines faster, leading to quicker recovery for patients. Identification of additional autoantibodies that help diagnose NAM earlier. Clinical trials showing that rituximab, a drug that targets B cells, can improve strength in many patients. Better MRI techniques that can measure how much muscle is damaged without needing a biopsy.